Your doctor has recommended getting a hysterectomy, the surgery to take out all or part of a woman's womb. Let's take a look at the woman's reproductive system. Here you see a womb, known as a uterus. This is the organ in which a baby grows. This is also the organ that causes bleeding during your period. The cervix is the bottom portion of the uterus. It dilates or opens when you have a baby and is the area in which a pap smear is collected. The vagina is the opening that babies are born from and the opening where women can have sex. At the top of the vagina is the cervix. On the outside, above the opening to the vagina, is the urethra. This is where urine leaves the body. On the outside, below the opening to the vagina, is the anus. This is where feces leaves the body. Attached to the uterus are your ovaries. These are the organs that make important female hormones and also release an egg each month with your period. The fallopian tubes help the egg travel from the ovary to the uterus. This is also the location where the egg can combine with the sperm to make a baby. Around the age of 52, the ovaries slowly stop making hormones and you stop having periods. At this time, you will also no longer be able to get pregnant. This process is called menopause. Fibroids are growths or masses that are common and can grow in different places in your uterus. These masses may cause your uterus to become larger. Fibroids, however, are not cancer. Some fibroids grow large and cause heavy bleeding and pain. There are medications that can treat some of the symptoms of fibroids, but there is no medication to make them go away. When medications stop working, or if the fibroid grows very large, the only definitive treatment for fibroids is surgery. Here are some examples of the common reasons for women to have a hysterectomy. First, fibroids are the most common reason for a hysterectomy. Next, abnormal uterine bleeding, which consists of heavy, painful, or irregular bleeding. Endometriosis and chronic pelvic pain, which is when the uterine lining grows outside of the uterus. This may cause abnormal uterine bleeding and pain. Gynecologic cancer, or cancers of the cervix, uterus, ovaries, or uterine lining. Lastly, pelvic organ prolapse, or the uterus dropping down into or out of the vagina. Not all hysterectomies are the same. Here are the different types of hysterectomy surgeries. First, supracervical hysterectomy is where only the uterus is removed and the cervix and ovaries are left behind. A total hysterectomy is where the uterus and cervix are both removed. Next, a hysterectomy with salpingectomy is where the uterus, cervix, and fallopian tubes are removed. Finally, a hysterectomy with salpingo-oophorectomy is where the uterus, cervix, fallopian tubes, and ovaries are removed. There are multiple ways to have a hysterectomy procedure done. The first way is referred to as open surgery. This is where a surgeon makes a large incision in the skin of the abdomen. This is done either up and down the middle or horizontally in the bikini region. Next is referred to a laparoscopy. This is where a surgeon can make very small incisions in the skin, allowing access for a camera through one of them. The next type of surgery is called robotic surgery. This is when the surgeon makes small incisions and inserts instruments through them that are attached to a machine called a robot. The surgeon controls the robot from a computer console next to the operating table. The last way to have a hysterectomy is referred to as vaginal. This is when a surgeon does not have to make any incisions on your belly. the surgeon makes cuts inside your vagina, and the uterus is removed entirely through the vagina with no incisions on the skin. The uterus can be removed in a couple of different ways. During open surgery, the uterus is removed as a whole through a large incision. With laparoscopic or robotic surgery, the uterus is removed through the vagina while the procedure is performed through small incisions on the abdomen. With vaginal surgery, the uterus is removed entirely through the vagina with no abdominal incisions. If the uterus is small, it may be removed through the vagina as a whole, like delivering a baby. If the uterus is too big to fit through the vagina as a whole, your surgeon will cut it up into smaller pieces for removal through the small incisions or through the vagina. If the uterus must be cut up into small pieces for removal, the surgeon can put it in a bag and then cut it up so that all the pieces stay inside the bag without spilling into the abdomen. The bag is then removed with the uterus inside and can be done either through the vagina or the abdomen. Each way of doing surgery has different benefits. With open hysterectomy, it is easier for the surgeon to perform the procedure than with laparoscopic, robotic, or vaginal surgery, but it will leave a large scar on the abdomen. With laparoscopic or robotic hysterectomy, you may spend a shorter time in the hospital and may have less pain after surgery, allowing you to return to work sooner, and will be left with small scars on the abdomen. With vaginal hysterectomy, you may spend a shorter time in the hospital, may have less pain after surgery, allowing you to return to work sooner, and you will be left with no scars on the abdomen. Although each way of doing a hysterectomy has benefits, each also has risk. With open surgery, there is a risk of excessive bleeding, blood clot, infection, organ damage such as bladder, bowel, and blood vessels, and even death. Overall, you are at a higher risk of infection and blood clot with open surgery. With laparoscopic or robotic surgery, there is a risk of excessive bleeding, blood clot, infection, organ damage such as bladder, bowel, and blood vessels, and even death. Overall, you may be at a higher risk of bladder damage with laparoscopic surgery. With vaginal surgery, there is a risk of excessive bleeding, blood clot, infection, organ damage such as bladder, bowel, and blood vessels, and even death. Some treatments for potential complications of surgery are blood transfusions if you have a large amount of bleeding, blood thinners if you have any blood clots, antibiotics if you have an infection, and additional surgeries if you have any organ damage. During open hysterectomy, you can expect a 2 to 4 day hospital stay and can go back to work in 6 weeks on average. This hysterectomy requires more pain medication after surgery and a longer recovery time at home, and you may be left with more scar tissue. With laparoscopic or robotic hysterectomy, you can expect a 0 to 1 day hospital stay and can go back to work in 2 weeks on average. This option typically requires less pain medication after surgery. With vaginal hysterectomy, you can expect a 0 to 1 day hospital stay and can go back to work in 2 weeks on average. This option also typically requires less pain medication after surgery. After your hysterectomy, it is not possible to become pregnant or give birth to a child. If your ovaries are not removed, they will still function the same as they did before your surgery. Your menstrual period will stop completely and never return after your surgery, though you may likely have some spotting immediately following your surgery while you heal. After a hysterectomy, your other organs will move slightly and fill the space where your uterus used to be. There is a rare cancer called leiomyosarcoma, or LMS. This cancer arises from the muscle of the uterus and can look like fibroids. LMS is a cancer that can spread all over the body and ultimately cause death. Fibroids, however, are not cancer and do not spread outside the uterus. The chances of a woman with fibroids having an undetected LMS cancer is approximately 1 in 500 women. This means that out of every 500 women with fibroids, 1 will have an undetected LMS cancer inside the uterus. If there is a cancer inside the uterus that looks like a fibroid, and the surgeon removes the uterus by cutting it up into small pieces, the cancer could spread throughout the body. We believe we can limit the spread by putting the uterus in a bag first before cutting it up. To summarize, the benefits of removing the uterus through laparoscopic, robotic, or vaginal surgery include less pain, quicker recovery, and smaller incisions compared to open surgery. However, there may be more risk of damage to the bladder. Removing the uterus through a large cut may be easier for the surgeon to perform. However, there may be more risk of bleeding, infection, blood clots, and death. It also leaves a bigger scar. If the uterus is too big to fit through the vagina as a whole, your surgeon will cut it up into smaller pieces for removal through the small abdominal incisions or through the vagina. Risk of unknown cancer within a fibroid uterus is approximately 1 out of 500 women. Lastly, spread of an unknown cancer in a large fibroid uterus may be prevented by putting the uterus in a bag and then cutting it up into pieces to remove it. Thank you for taking the time to learn about the different procedures of a hysterectomy. We hope this has been educational and would love to answer any questions you may have about anything you have seen in this video or elsewhere.